Next, we have Nicolas from Sexperto.
21 million girls between 15 and 19 years and 2 million girls aged under 15 become pregnant every year in developing regions. This reality is directly associated with a higher maternal and child mortality, as well as to intergenerational cycles of poverty and poor health. Hoping to change this, we created Sexperto. Sexperto was built after hours and hours of talks with teens and young adults that let us understand the roots of the problem: information gaps, prejudice towards contraceptive use, herbal myths, and access barriers to birth controls. One of the most noticed in this process is that when talking about sexuality, what teens actually have are questions. Questions they are too afraid to ask in a classroom setting, and questions that need to be answered immediately, anonymously, and whenever and wherever they are. So bingo, the value proposition was clear: an innovative, disruptive, and cost-efficient Google-like platform that provides expert answers to those questions and free and immediate access to birth control appointments. So far, we have had incredible success. We have received more than 800,000 visits and scheduled more than 1,000 birth control appointments. But perhaps the most important outcome has been the sharp decline in teen births since the page launched. Bogota has seen a decrease in 12.7%. And while this is the result of various citywide initiatives, even the mayor of Bogota has publicly recognized Sexperto as one of the main tools to attack this problematic. Now, why is Sexperto so powerful? The first answer is because teens actually like and use Sexperto. It's simple, it's clear, and it does what they need it to do. Second, because it's accessible and scalable. We can literally export Sexperto anywhere in the world. But third, and most importantly, because Sexperto manages to capture teens and canalize them to individual care, bridging the gap between public health efforts and the assistential part. How was this even possible? Well, we managed to engage the entire healthcare ecosystem through a shared value effort between Bogota's government as champion and client, Latin America's leading hospital as medical experts, and we as innovators and entrepreneurs. Now, knowing the validated success of Sexperto, we now feel that we have the responsibility of bringing it to many other regions and countries. We know we can avoid many more unwanted births and help teens live responsible lives. But we need your help. We need Solve's ideas, connections, feedback, and partnerships in order to scale our impact. Not just by deploying Sexperto in other ecosystems, but also by applying the same model to other public health challenges. Thank you very much.
Thank you. Questions from the judges?
Thank you so much. Really, really interesting platform. I know right now your main target is teens, which is absolutely wonderful. I also wonder if there's ways to expand your model to other populations, parents of teens, for example, who may have questions about how to talk to their teens, how to educate them, questions for themselves, things like that. Have you thought about other populations this might be useful for?
Yes, two answers. The first one, yes. For parents, this could work as well. We could even integrate a module just for them, and it could be really powerful. And the second answer is we've been actually working on implementing this same model for mental health and for drug abuse in 2019.
Katya?
Thank you very much. It's a very needed undertaking today. Have you considered collaborating with other platforms, kind of knowing that the web is not accessible everywhere, but for example with radio, we see that in other countries, but also are there any consideration working with schools and some of the schools' curriculum on comprehensive sexuality education?
Yes, actually Sexperto right now has been integrated to the curriculum of 392 public schools back in Bogota. They are literally sitting kids and teens for an hour answering their questions on Sexperto. At the same time, we've implemented an SMS system to answer questions through that. And we are open to explore other alternatives as audio answers, as we talked yesterday.
Julie?
Actually, question was directly tied to hers. We talked yesterday about
Yes.
what is close to my heart is marginalized communities,
Right.
rural areas. There's, this is almost like a web-based platform. They don't have access to this fancy stuff. Community health workers, how do you train them? What kind of access would you give to them? I think more thinking needs to go to that if this is going to be successful in those communities,
Right.
in terms of marginalized communities in rural areas. So
Right.
I would like to see that strategy. Do you have some thinking on that? I know that you answered, but
Yes.
is there more
no-
that you want to say on that?
Just simply that the District of Bogota, actually the Secretary of Health is sitting right here. They have formed a lot of professionals that basically go to these marginalized and really far away places to be able to implement Sexperto as a live Sexperto, so to say. So they sit there, use Sexperto as a tool, and answer people's questions. So I think that could be also an alternative.
Ferdinando?
It was great presentation. What I find particularly attractive is that content seems to be demand-driven. What do you do with all those data? How do you transform this then in the feedback back to the user?
Thank you.